Hello everyone, my name is Levi Calderon and this is my final care plan presentation for Houston Community College Spring 2016 RN program. Pathophysiology of a brain aneurysm. The definition includes a weakness in the vessel in the brain in which the epithelium has ballooned to the point of near rupture or leakage. The etiology and risk factors. Pre-existing genetic organic brain diseases, hypertension, atherosclerosis, diabetes mellitus. Signs and symptoms can include headache, nausea and vomiting, increased cranial pressure, confusion, and aphasia. Treatment includes surgical coiling with a titanium wire which is entered through the femoral artery, or a surgical clipping in which the balloon is clipped, and that is an open brain surgery. The prognosis includes 50% mortality without treatment, 25% mortality within 1 week anyway, and also a risk of stroke is increased. The patient history. A 39-year-old female presented to the emergency room complaining of a headache, nausea, and confusion for 2 days. The husband stated that the patient had been mixing words today and dropped a glass, so he decided to seek out help. The patient's history includes hypertension for 5 years, a C-section in 2006, smoking for 20 years, sedentary lifestyle, anxiety disorder, and a family history on her father's side of stroke. Diagnostic tests included a head x-ray, urine analysis to rule out pregnancy in the ER, and blood tests to check the CKBB levels, which were elevated. In the angiogram to the left, you can see the balloon where I'm pointing with my mouse there. On the right, you see the CT scan, and where you see yellow arrows is a hemorrhage. Home medications included aspirin, garlic supplements, and lisinopril. Inpatient medications included metoprolol and nimopridine. Those were to control blood pressure to prevent worsening of the intracranial pressure and hemorrhaging. Glucosate sodium, and that was to have a easy bowel movement in order to prevent a strenuous Valsalva maneuver. Ondansetron, and that's to prevent nausea and vomiting. And hydroxyzine, and that's to control her anxiety, which increases blood pressure and as a result, intracranial pressure. Nursing diagnosis number 1, ineffective tissue perfusion, cerebral, related to bleeding or vasospasm as evidenced by CT scan results, increased intracranial pressure, and a headache. The goal would be for the patient to demonstrate improved cerebral perfusion. The interventions are those listed there. Outcomes will be for the patient to demonstrate an increase to maintain an intracranial pressure between 5 to 20 millimeters of mercury during a shift. The patient will be free from a headache during a shift, and the patient's blood pressure will remain less than 130 systolic during the shift. The evaluation will be to continue the care plan because no revision is needed due to the outcomes being met completely. Nursing diagnosis number 2 included disturbed sensory perception related to the restrictions of the aneurysm precautions as evidenced by the light sensitivity, change in mood, and insomnia. The goal will be for the patient will remain free from disturbed sensory perception. Interventions are those listed below, all related to decreasing sensory stimulation. And the outcomes will be for the patient to verbalize when stimulation is overwhelming to the nurse during a shift. The patient will verbalize 2 restrictions and provide rationale by the end of the shift for those. And the patient will self-limit visitors to 2 at a time during the visitation hours on the shift. The evaluation would be to continue the care plan because no revision is needed because the outcomes were met fully. Nursing diagnosis number 3, anxiety related to the sensitive nature of the brain illness, as evidenced by the patient expressing fear of her dying, elevated respiratory rate, and elevated heart rate. The goal would be for the patient to maintain an anxiety within acceptable range suitable to her. Interventions were all related to reducing the anxiety. Outcomes would be patient will request anxiety medication when feeling overwhelmed during a shift. The patient will demonstrate the use of non-pharmacological methods of reducing anxiety by the end of the shift, and the patient will express an understanding of her brain aneurysm disease process by the end of the shift. The evaluation will be to continue the care plan, but a revision is needed. The patient's mood was not conducive for teaching of non-pharmacological methods at this time, and the patient also refuses to stop smoking, which worsens her atherosclerosis and puts her at a higher risk of hemorrhaging and another brain aneurysm. So the outcomes were only partially met. You can see my references there, and this concludes my presentation on my final care plan. Thank you.